And this 50-year-old guy shows up, and he's got high blood pressure, high cholesterol. His thyroid is shutting down. He's got back pain that won't quit. He's 150 pounds overweight. And this is guys, but ladies, if you're struggling with your thyroid, if you have joint issues, rheumatoid, all this, it's the same thing. When you come in, the first thing we're going to check and analyze is the health of your spinal cord between your brain and your body. And it's not a complicated thought. If it's kinked up in there where your bones, instead of allowing things to flow, where the bones are smashing in on your spinal cord, you may or may not feel that, right? You could have pain, but you might not. You probably won't have pain, but it's keeping your body from working out 100%. That is where we start, and that is how the miracles happen, because I know how God made you. God made you with a spinal cord. He made you with a brain and a spinal cord and all these jillion little nerves that go to everything. They go to your liver. They go to your heart. They go to your pancreas. They go to your colon. They go to everything. And if your brain can't communicate to your body is going to struggle. So this guy comes into the office, 50 years old, has all these issues, all these medications, took an x-ray of his spine in his neck and in his lower back. His spine was kinked. And listen to this, he had no neck pain, 0. But his neck was bent over. It should look like a curve on the x-ray, which we would explain all this to you. His curve was reversed into the other direction. And what that does is it takes the spinal cord in there and kinks it exactly like a water hose. So if you kink a water hose 50% and only 50% of the water is getting through there, obviously what's going to happen to your body? Well, in his lower back, he had fallen when he was like 15 years old and smashed his tailbone, and there was a part of his bone had actually fractured off, and he had no idea. The doctors never said anything about it. We started working on him yesterday, so we got his first treatment in the office, which is thorough. You're going to get exercises. We're going to be doing a specific set of adjustments to relieve pressure on your spine, not for his pain. I didn't touch his pain. We got his neck and his spine working, so his brain could start healing him, and he got off the table and he could bend over and touch his toes for the first time in years. His knees started feeling better, and I can tell you he's going to be off his blood pressure medicines and his cholesterol drugs within a few weeks, if it even takes that long. Ladies, if you've got thyroid issues, that's a big one. I talk about that a lot. We talk about that a lot because it's so diagnosed. If you've got weight issues, if you feel just groggy and you're sort of dragging and you don't have the energy that you used to have, and maybe you've talked to an endocrinologist and they're telling you that your hormones out of whack, you've got to start with your spine. I don't care what they tell you. If you were to ask the endocrinologist, hey, what does my spine have to do with my hormones? I have no idea, ma'am. That's because they're not trained in it. They look at the symptom, not the cause. And if you leave the kink in your spinal cord, the problem is only going to get worse because your brain can't get there. Please call us up. We want to see everybody get healthy. We've been on here 10 years on the word, 100.7. What does that tell you? It tells you that it works. People call, they come in, their lives change. If you want to get well, if you want to be here when you're 60, 70, 80 years old and beyond, not having to rely on medications, not having to go to the doctors, then we are the place for you. We'll show you. We'll walk you through it. 877-778-6978. Call us up, make that $40 donation over the phone, keep your appointment, and we'll start walking you through it.